Everybody is standing up together for the long-term success of the hospital, and it's essential.
BusinessJournalDaily.com 3 Minutes With is brought to you by Farmers National Bank.
Save, borrow, and invest with Farmers. Take heart knowing you're helping create a strong community. Mind your money at Farmers. Talk directly to local decision makers about your loans, investments, and insurance. Farmers. Fiercely local, fiercely loyal.
Several months ago, we hosted, or not we, but the hospital hosted an open house for the community to announce that they would be reopening. And that was a very celebratory day. There were hundreds and hundreds of employees of the hospital that were here to celebrate. And then we went through the many long days and nights and weekends and now months since that event. And so today was about where we stand. There's been a lot of financing committed to the hospital, and a lot of it has gone out in the forms of salaries and benefits and insurance payments and vendor payments that just gets recycled over and over again through our community. And so today was really to have a very transparent discussion with the leadership of Tenor Health and the community who has participated in this $11 million term loan, and to provide an update to the community and folks like you.
The hospital reopened March 18th, and on March 16th, we reopened some of the core services besides medical, surgical, or ED. And so we have surgical services, we have wound care, we have diagnostics, we have inpatient rehab, outpatient rehab, we have occupational health, we have, I may have mentioned this, but wound care, pulmonary, surgery, orthopedics, cardiology, our cath lab, and so the list goes on and on and on in terms of the services that were here previously that we've been able to restart. And we have over 575 people working for us, and then some contracted people as well. So, I would estimate it at over 600 people regularly providing care and treatment, as well as the various vendors that we work with and suppliers. So Medicare approved our, they call it a CHOW, change of ownership. So you get the tie-in notice essentially to tie your provider number with your tax ID so that they know the right entity, and it goes into your banking information and all of that. So now we tested the systems to make sure that we can actually drop bills. And yesterday we got the good news that everything is good to go. So we have started billing, and we'll be seeing those revenues coming in. So cath lab, we're doing diagnostics. We can do some procedures that are low risk or on an emergency basis, but we did file exceptions that are needed in the Commonwealth to be able to fully reopen. And so we anticipate being able to start that in a few weeks here. The residency program. Yes, when they were displaced, they reached out to us, and the residents used to float through Sharon before. And so they're housed here in this building. They were physically locked out of the other hospital. And so we gave them a home. We said, the School of Nursing is no longer here. We have the space. Please do occupy the building. And they're also rotating through certain departments, internal medicine, surgery, ED, behavioral health. So it's been great. I'm a big proponent of education. So to be able to educate the next set of professionals, and hopefully they'll stay local as well.
Collectively, this is the largest economic development effort that's ever been put together by Mercer County for one entity. We obviously make a lot of loans, and all the agencies are supporting businesses within their communities and for us across the county. But to pull together what is right now 7 different funding organizations to generate about $9.2 million of that $11 million that we're trying to raise, that is just an incomparable effort. It's never been done before.
Not only has it been an integral part to get the loan, I mean, obviously MPT gave us a loan initially, and now through Penn-Northwest, we have this additional loan. And, it's a partnership. Everybody is standing up together for the long-term success of the hospital, and it's essential.
As an economic development agency, part of our job is to take some risk. And it's a calculated risk, but it's definitely a risk. And to that end, we've invested through our revolving loan fund, our maximum allowable amount of $350,000, as many other funders within this term loan have. But just so everyone is aware, these are funds that have been created over the years through our revolving loan fund. In nearly all cases, they're not taxpayer dollars, and they are for the explicit purpose of revitalizing this community. And where you start with revitalizing community is protecting the assets and the employment that is here. We cannot afford to have anybody else leave this area. We need to attract people to this area, and healthcare is part of that backbone infrastructure. It all begins and ends with healthcare and education. And if you don't have high quality educational institutions and high quality healthcare with easy access, we're never going to rebuild this community back to this 130,000 to ultimately 150,000 population that we're striving for.
BusinessJournalDaily.com. 3 Minutes With is brought to you by Farmers National Bank.
Save, borrow, and invest with Farmers. Take heart knowing you're helping create a strong community. Mind your money at Farmers. Talk directly to local decision makers about your loans, investments, and insurance. Farmers. Fiercely local, fiercely loyal.